Of time, we're going to go ahead and get started. Again, welcome to those of you joining us for this Tahoe Chamber special town hall session, as there's lots of breaking news and developments around us all as we head into the latter part of August here. We want to thank the folks from Picasso, the Modern Way to Buy a Second Home, for sponsoring this town hall series this year here for Tahoe Chamber and our community. So we have two guests today. We have Dr. Matthew Wonnacott. Dr. Wonnacott is the Chief Medical Officer for Barton Health. And we have Dr. Todd Cutler, who's the Superintendent of Lake Tahoe Unified School District. We're going to start off this morning with Dr. Wonnacott, get his update on impacts of the COVID variant and related topics. Then we'll take your questions and answers for Dr. Wonnacott, and then we'll move to Dr. Cutler and get his latest update on the start of school coming up at the end of the month, and all of the impacts from COVID and other factors at the school district. So again, that's Lake Tahoe Unified School District on the California side of South Shore. So Dr. Cutler, thanks for being with us. Dr. Wonnacott, turning to you, sir. This has been a day when every day something different seems to happen. And we understand new impacts from the COVID-19 variant, the Delta variant. And so please give us a summary overview of what from the hospital perspective is happening, what people in the community, residents, business owners, what we all need to know about the impacts of this rather insidious and highly transmissible variant.
Well, you know that it's going to be affecting you in one way or another. And we hope that it doesn't affect you by actually getting infection within your body. But I tell you, it is quite prevalent throughout the community and throughout the state and throughout the country. And so the remarkable thing is the coronavirus, that novel coronavirus a year and a half ago first entered in, it had a fairly high rate of transmission. And it was, while it wasn't as deadly as some viruses, it definitely created a severe respiratory syndrome that occasionally did cause somebody to pass away. So we got through that, and we got the well, we didn't get through it, but essentially, as the virus continues to replicate, it's hard to think on the line of how many billions and billions of these small particles are. But many of you are familiar with the fact that there's little mutations that can occur, and they're happening all the time. But when they happen in a way that helps that particular virus, those that replicate after that mutation occurs, then it's going to become prominent. And it's going to be much more likely to spread. And in the case of the Delta variant, we heard about that from overseas, but as that became spread throughout the United States, it was apparent that it was replicating much more efficiently than the original version. And the characteristics of the virus are such that it can attach very easily to the cell. It can replicate very well. And we have very high levels of the virus in our respiratory tract, in our system, that can then be spread to others. So much more efficient. And so that became, in the last couple of months, very quickly, the primary type of coronavirus that we're dealing with. Now, there's a lot of people looking to see if it's actually more or less deadly, if it is more severe in the pathology that it creates in our body. And the jury's kind of out still. We don't believe that it's significantly more dangerous or less dangerous at this point than the original virus. What we do know is that it spreads very easily, infects more easily. And so with that, it gets into our community, and anytime if you're shedding much more of these particles and you're within a small distance, you're able to breathe it in, to touch and pull it into your system, then we get the infection. So a lot of that you already knew, but I can tell you the rapid rate that it came in is pretty remarkable. We saw this bump with the original coronavirus last summer, and then the big spike we dealt with at Barton was in November and December, and then it cooled off mid-January. And at that point, all the hospitals were full, and then it started to calm down with that version of the virus. And then we thought, oh, finally, we're in a better state, and we were. Unfortunately, then, because of that variant, it's now spiking again. So our positivity rate here that we check when we do testing, the percent of those tests that we do that come back positive, or what the positivity rate is. And we only are testing those who have symptoms. So there's other areas other locations, when you get tested at a pharmacy, for instance, there are places you can go with no symptoms and still get a test. Our positivity rate will be a little bit higher because we're testing people who have symptoms. And our rate went from what was down below 2 for a short time, about 2.5 months ago, has now bumped up to 12%. So that's where we are as far as the hospital testing goes. Now, as you look at the numbers across the state of California actually has a positivity rate of 6%. So it's we're higher. We're double that number here in Tahoe, and El Dorado County itself is about where we are, 11%. When you look at the Nevada side of the house, the positivity rate is just even a bit higher. So Nevada as a whole is 15% positivity rate, so higher than the numbers we're getting at Barton. And then Douglas County itself is a higher, even a higher compared to the other areas in Nevada, is at 20% positivity, as is Washoe County. It's about the same. And so that's where, that's how prevalent the virus is as we do all these swabs. Now that kind of goes aligned with the vaccination rate. So the remarkable thing is that the vaccine that was developed showed that it was quite effective. And when we pushed that forward in December, we were successful to get our own staff to be vaccinated up to 81%. We're very, very pleased with that number. The community is not quite so high. So the vaccination rate that we have here in South Lake Tahoe is about 41%. So that's an area that we would just love to push on, because that vaccine is still effective against this Delta variant. You may have a lot more of it and it attaches easily, but if you have an immunity to it, then you're going to fare much better. The numbers that we have as the total numbers of people who are infected with COVID here rise, then we're going to get a bump up in the number of hospitalizations. And right now, in fact, today we were at 10 in our hospital, 10 patients who had the coronavirus. And 4 of those were in our intensive care unit. We have an 8-bed unit. So we're not completely overwhelmed, but what's happening here is happening everywhere. And so we have times when a patient would need some type of care that would be at a higher level of a higher tertiary center, and we'd like to transfer them to, say, Renown or into Carson Valley or the other direction. But these other areas, and especially, as I said, in Nevada, have a fairly full bed capacity. So we're keeping patients, and we're certainly those that really have to get to higher level of care, we're able to work that out. But what was easier to do is now more challenging, because everybody in the region is struggling with the number of people hospitalized. When I said 10 that are in our hospital, that's about a third of our inpatients right now. Now, those numbers will fluctuate a little bit. The highest we ever were was in December with about 16 that were in at any given time. And I would say, when I get back to the vaccine piece, is that it is almost always the patient that gets severe enough to come into the hospital is unvaccinated. Now, there are some where there is a breakthrough, and certainly the vaccine isn't perfect to keep people from getting the virus at all, but those who get the virus and have some immunity fare much, much better. We have more patients right in that 40 to 50 age range, which is different than what we had in December and January. That may be because of vaccination that was really pressed for those who were older in the community. And a lot of us who are 40 or 50, or a lot in that age range, did not get vaccinated. So that's been pretty significant, I think, for our health system. We would love to encourage people to get the vaccine, because we've had, as the United States has had over 150 million receive this, so it's been shown to be safe, and again, the efficacy is there. Now, there's also a question about the boosters. What happens over time when we have received that vaccine and we wane in our immunity? Well, what happens is as that immunity wanes, just like we had for the influenza virus, then we get a booster. We would normally get a booster to boost our immune status. As you probably have heard, the FDA did approve for those who are who received the vaccine, and now they have, or they had an underlying immunocompromised state. They've been approved to get a third dose, and that just started this week. So we're working on our processes to get those who fit those criteria and get them in for their third dose. And it's expected, as you've seen in the news, that a third dose will also be approved in the coming probably 4 to 6 weeks for everybody to get a boost in their immunity and help us battle the virus. So the take-home message that I've had from all of this is that it's a very serious pandemic. It isn't going to, we are going to get over it, and I'm excited to say that we're going to get back to a point where we've got more immunity and we'll be fine. But it is serious. We do have occasions when people in their 30s and 40s have died from this virus without significant underlying health conditions. And so it can be very serious in some people, and we can somewhat determine who might be more challenged because of their underlying problems. But again, for those healthy people who get it, there's no way to know. And then we've had them come to the hospital and really suffer. We are very happy that our own employees are that much immunized, but would love to be at 100%. What the California Department of Public Health has mandated starting Monday is that all healthcare facilities in the state of California will ensure that their staff are either vaccinated or that they're tested. And so those of our staff who work in the acute care hospital who are not vaccinated, we are being mandated now to test twice a week for them. So you go get the swab in your nose and send that off and get a result back. And you do that twice a week. For our outpatient clinics, the mandate is once a week. And so as we work through those 20% of our employees that for various reasons did not get vaccinated, we have to get the process polished, and we're pretty darn close. Now, this also puts a lot of pressure on us to get the supplies to be able to satisfy this requirement. And so there's always a lot of work that goes along with this. And we've had working groups and teams that have been spending a lot of time putting this together. After the 30th of September, then the California Department of Public Health states for Barton and other healthcare facilities that we have to mandate that our employees are vaccinated. And then our choice is either you don't work here in the hospital or you're have to be vaccinated. Now, we've done what we could to get those employees who can successfully work from home, and they can do that, then that's fine. It's just entering the facilities that is a problem. So that's an update regarding where we are. The numbers of those infected, as I said, that went up, but it's kind of plateaued a little bit. I feel that the last week has been not the continuing rise that you see when it's completely out of control. It's plateaued, and my anticipation is that it will start to come down as people are shut in a little bit more, or as more have immunity. And we've actually, with the efforts to get people vaccinated, we've seen some people who had held off up until now who are saying, okay, we'll give it a try. Many were waiting on that FDA approval, and that is that's been a factor for some. But I tell you, we've never had a vaccine out there to the number of 150 million vaccinated and successfully, and feel more confident than we are right now in using this vaccine. So.
Yeah, Dr. Wonnacott, we're starting to get some questions come in. So I want to remind folks, if you have a question for Dr. Wonnacott, please put it in the Q&A box. The first question that's come in is, if a person had the virus, do they have immunity, or would it still be important for them to get the vaccine?
Great question. The answer is there is some immunity, and the vaccine is still protective. So the answer to both is yes. The vaccine actually increases the protection that you got from the wild type virus that gave you the infection. So yes, you're going to be better off than if you're facing it for the first time, but you'll be actually much better off if, in addition to that, you had the vaccine.
Is there a difference between, because you've talked about the third dose that has been recommended or suggested for people with immunocompromised conditions, and now they're talking about a booster. Is there a difference between a third dose and a booster?
No, that's the same thing, Steve.
Okay.
Mm-hmm.
Okay. So in other words, if Barton begins to get a supply of boosters, and for some of us, it's been more than 8 months since we had our second shot, how do we find out if we're eligible? How does that work?
There are, we'll get that advertised out there as far as the approval for that third dose initially, when we're waiting on everybody to get approved. But it's essentially anybody with an immunocompromised state. Now, we know that we're going to end up with a booster for everybody. And so we're just going to, as people have some reason that they are significantly immunocompromised, we will give them another dose of the vaccine. And it's not going to be quite as strict as if there was where we're hunting down every last ICD-10 code of what your diagnosis has been. So we'll get that out there, and we'll start to get that done. For many, it won't be too long, and we'll be giving this to everybody. So so it's coming.
Okay, very good. So from a standpoint of a business owner, I think a lot of them are doing everything they can to get their employees vaccinated. I know most of them deal with customers and clients, and they don't know if they're vaccinated or not. Any advice from a medical perspective on how businesses should think about operating these days?
Yeah, that's a really great and challenging question. For our own employees, we have the HIPAA laws related to health information. We as employers are allowed to get information, but it's still, we've had to, the attorneys have told us what we can and can't say and how we can go about that. One thing that's pretty evident is that there's been a lot of animosity and a lot of polarization. We all know that. And as people have gotten into arguments or even fights related to either not vaccination or being vaccinated, et cetera. And so I wish I had the perfect answer. I think while we don't have I wouldn't know what wording that you could use when you have to find out or would want to find out if your employees are vaccinated. I would just continue to encourage that the safety and efficacy has been proven, and it continues to be proven, and just push on that. I'm not a employment lawyer, so I don't know all the ins and outs of what you can and can't do, but I would do this in a very positive way as best as you can, be understanding there are people who actually do have a reason that they wouldn't get it. Those numbers should be pretty darn small though. And for those who are pregnant, it's been approved and validated by all of the OBGYN groups that would say that you are much better off to be immunized than to get the actual virus.
Another question, Dr. Wonnacott, what is your best estimate on when a vaccine will be available for children under 12?
That's a great question too. My best estimate, I hate to even throw something out there. I would say by the end of the year, but I don't know enough. I'm not involved in the development and the various stages that has gone through. So I think that we'll just throw that out as a general number, but I'll have to get back to you when I learn more of what's going on there.
Yeah, and Dr. Cutler is next and talking about the school situation, and he may have some counsel along those lines as well. So, and how, Barton there was testing resources at the college in the community that was paid for by the state. There seems to be, I know you have testing opportunity for your people and people, that are part of your extended patient network. If somebody is just out in the community, how could they come to Barton, or are there other places where they could get tested in our community?
Yeah, you bet. So anybody who has symptoms, whether they've ever been to Barton, are associated with us or not, we ask them to call the phone number that's been advertised since the near beginning of the pandemic, which is 530-600-1999. Think Prince, 1999. And so that number, for anybody who has symptoms, would love them to call so we can talk about it with them. Or if they've been exposed and it's somebody in the family has COVID, we could talk and counsel through that. If you just are interested and you have no symptoms, then there are other locations for testing, and many have learned which pharmacies that they can go to. Several of our local pharmacies do the testing. LHI is the company that was contracted for, and they've been testing since early on as well. Remember, they were at the community college, have been at the airport, and now they're moving to an even easier location, is my understanding, in the coming week. And so LHI, if you were to Google that and you put a COVID test in South Lake Tahoe, then you'll be directed to them, and they have capacity.
Okay. Once again, the COVID hotline for the hospital is 530-600-10 or 1999.
Correct.
So 530-600-1999. You're working on having mandatory for all your employees to be vaccinated, and you're at 80-something%. You're needing to go to 100. Are you anticipating any staffing shortages if there are some challenges along those lines?
Yeah, we are working on everything we can do, because yes, the answer is yes. Well, we already are, right? Just like everybody, we have staffing challenges, and there are many who had opted during the pandemic to retire. There are many who we counted on just as traveling staff that now aren't traveling like they had been. And so we have a fair amount of open gaps in our staffing. And there is a concern about that. We certainly feel it's important that we have people vaccinated and know if they're infectious, et cetera. And so we're working through this mandate just fine, but it very well could have an impact. I don't know how big. We've had several of those 20% that weren't vaccinated, several, meaning a handful so far, who says, yeah, I think I'm going to do it. So we'll just see how that rolls out, Steve, over the coming month.
Okay, we got time for like one additional question here for Dr. Wonnacott. This one is, when an employee has been exposed through contact tracing, is a rapid test available, like CVS, valid? Is that a valid test for a return to work? Or should they do a different kind of test?
Well, so this goes back to the testing about the different types of tests and the rapid ones. Now, the PCR, which is that polymerase chain reaction test where we have a much higher sensitivity, is available and can be done relatively quickly. And that's the one that we count on when we're really trying to determine if it's positive. The other tests are called antigen tests. And those are ones that can be done right in your room. I mean, it's the point of care. You can just get that done. Not that that's a bad test, but its sensitivity is less. So if it comes up positive, then you can feel quite confident that you're positive. But if it comes up negative, the PCR could be positive and that antigen test is negative. Now, it's hard to be perfect in a medical world and in our world, and medically there's imperfections. So no test is perfect, and it's better than nothing. And those who are counting on that antigen test, there is some goodness to it. So I'm not poo-pooing it, but the PCR tests aren't as readily available to be done quickly. For instance, we at Barton can do a PCR test. We have a limited number of our own supplies. So all of those that don't have to be done in the next 3 hours get sent elsewhere, and we get the answer back in just over a day. And so they can be relatively quickly. They're just not quite as readily available. So I don't know if that answers the question well enough. But.
Well, it is a challenging question. When people should people wait the recommended 3 to 5 days after exposure before testing?
Yeah, if you can do so, meaning that you've got 3 days that you would going to be home and you're not missing out on a paycheck or whatever it might be. Well, hopefully you wouldn't be working anyway. Then it is best to get tested after it's had time to incubate. Okay. However, if that's not possible, then we just recommend people get tested. Now, you can call and ask those questions. We'll answer them case by case because everybody's a little bit different in what their story is, right? But it is more effective. Your sensitivity is better after you've had several days for that to replicate within your system, or you might end up with a false negative test.
Got it. And finally, just for employers or others that are having to do contact tracing, how many layers deep do they need to go for testing? Like who you live with, friends at a social gathering, how many layers in that case?
Yeah, well, what we do is we just we go back 2 days and we go with everybody that you can, meaning if you were a close contact. Now, by close contact, I'm talking about 15 minutes within 6 feet. And so if you can think through and for the last 2 days determine those that you are within 6 feet for 15 minutes, then we look at everybody who's in that scenario. And so that's why if you do have distancing, that helps quite a bit. So,
right. So distancing, wearing the masks, those things still continue to be measures that have proven to be effective.
They are. Well, you can't go around if you're not close enough to them, it's not going to get to you. So it's just how it works. But we recognize that it's impossible to live completely that way all the time. So,
Well, Dr. Wonnacott, we want to thank you so very much for being with us today. Dr. Matthew Wonnacott, the Chief Medical Officer from Barton Health. We'll see how the Q&A go, but if you have other duties, we certainly understand. And we're going to shift now to Dr. Todd Cutler, who is with us, who you know is the Superintendent of the Lake Tahoe Unified School District. And some of the questions and some of the responses here, I think, relate to some of the challenges you're dealing with, Dr. Cutler. But you said, as we're going forward, that school will begin. So welcome.
Steve, thank you very much for having me. I appreciate it. Just to start, I want to thank you and everybody that's here to continue to work through all of this craziness of COVID. And I use that craziness because it is somewhat crazy to me. Steve, before we started, you'd made a comment about coming in superintendency right as COVID got, I started in July of 20, and of course, this all started in March. And it has been quite a challenge in regards to thinking about schooling and navigating all of the components that COVID has thrown our way. And I do want to tell you, so thank you to everybody that has worked with us and has been patient and understands the dynamics that we're working through. Also want to say that I've been very proud of our school system. Last year was multiple challenges, yet by the time we ended the school year, we had our students all back in school. I thought we ended on a really high note, despite all of those things that we faced last year. And when we ended the school year, I will tell you that we all were in this mindset that we were going to return to school this year as normal. That was where our mind was. Obviously, we're not the medical professionals, and we're the educational professionals. But that was our thinking. Okay, hey, we're in a good place. The vaccines are out there. Seems as though all of the restrictions are being removed, and we got really excited about that. And unfortunately, as we've heard, Delta variants has really changed that for us, and has changed the school preparations and planning as well. And with that said, just to talk briefly about that, just so you know, we actually had students, a number of students that started some schooling last week. We've had what we call enrichment camps. We provided these enrichment camps were meant to provide students some activities that they may have missed out on that we could not do for them during last year's COVID year. And that we were successful in that process. We did not have to remove anyone or quarantine anyone during that time. Of course, it was very small numbers, approximately 200 students participating. This week, we have what we call Jumpstart for kindergartners through 5th grade and 6th and 9th graders. We've had about, I don't have the total numbers, I think it was 250-ish elementary students and about 150 plus or minus middle 6th graders and 9th graders. So, and we have gone through this week without having to worry about quarantining and having to deal with the process. But on August 30th, we welcome almost 4,000 students to the first day of school, and obviously we'll be facing some different challenges. Colleagues, schools districts on the West Slope in El Dorado County have all started over the past few weeks, and I'm able to watch and see what they're dealing with and how they're doing all of the components that we face. And unfortunately, we see a lot of students having contact and contact tracing and quarantining happening. And so, those are things that we have to prepare for. As I stated earlier, we really were hoping that we would be able to start the school year and not having to even worry about masking or any social distancing, but just to truly be back. And maybe that was very naive on our part, but I think it was more just hoping and wanting to be back to school and have our students in the school as they know it and as our teachers know it. Unfortunately, as we moved through the summer, the California Department of Public Health came out with mandated guidelines that changed that. One of the important things is that at this point in time, those guidelines provide and allow us to have all of our students in school because they removed and eliminated the social distancing requirement. It's suggested, but if anybody understands schools, very difficult to distance students. And that's why we had to do hybrid mode last year at times because to meet the social distancing requirements. it was once at 6 feet, it got down to 3 feet, and we were able to manage that much better. And we're going to continue to make our efforts to keep students distanced, but that's not a requirement of the coming year. One of the requirements that is in place is the masking of all students and staff in the schoolhouse. Interesting enough, that's been in place for several weeks now. Just last week, the CDPH then also made it so in any public meeting now, face masks are now required. So at our board meetings, face masks are now required as well. And so, we've had some folks that have voiced concern and are not wanting for us to enforce that. We looked into that legally. Do we have the option? Both our attorneys, our insurance groups say we do not, that we are required by law to follow the CDPH guidelines, and we will. One of the challenges, and which we heard from Dr. Wonnacott, is testing and contact tracing. There are requirements regarding when we have to quarantine students, that is close contacts within a certain period of time. And then what happens thereafter, it does have some variable components to it, whether vaccinated, whether there are symptoms in place. And then after that 3 to 5 day period, if students were quarantined, they have the ability to get tested and get back into school. So that's a good thing, because last year we had to, if you were quarantined, you had to be gone for that certain level of quarantine. And so with testing, we can get students back into school much quicker. But it's still obviously a dramatic challenge for us as we think about what we're seeing from other school districts throughout California that are now open and having dramatic cases pop up and then having to quarantine students. So, it's going to be a challenge for us, and we're going to work through it as best we can with the intent that students need to be in school and students need to be in school learning. Talk about the masking requirements. It's the one thing I've heard from parents for the most part. I mean, I have parents that are just adamant that they don't want their children to wear masks. I'm adamant. I have parents that are adamant that all students and staff have to wear masks. But the most part of the parents that I hear from are, we just want our kids in school. If they have to wear masks, they have to wear masks. And the reality is, none of us really want to have to wear masks, but that's just the requirement we have in place. If a parent doesn't want their child to wear a mask, the option is to truly go to our virtual schooling components, either elevated or our ILA program, which is an independent study program. There's a recent law, it's called AB 130, that changed some of the requirements of our ILA. Students are required for certain time of synchronous and asynchronous work if they're in those systems. Our elevated school that we started last year actually meets up with all of the requirements of AB 130. So, and that school will be open for K-9 this year. So we want to make sure that PK-9, that we encourage those parents and any that are fearful regarding the Delta variants or COVID, that they go that direction, and we have space available, and that school is ready to enroll more students into it. Also, just in recent weeks, the mandate came out regarding our staff having to be vaccinated and or tested. And Dr. Wonnacott talked a little about this. Testing actually is a challenge in making sure we have testing all aligned. There is the antigen test or the PCR test. If a staff member does not submit their vaccination card to HR, they're going to have to either do twice a week antigen test or once a week PCR test to continue working. And of course, if they come up positive, then a quarantine situation would occur. There's a lot of information I've just provided, and like I said, what I'd really be rather talking about is the excitement we have in regards to all the activities we're doing to improve on education and teaching and learning in our school system. And I know that this is the most, I want to say, I was about to say most important, that's actually the most important, but the most pressing item for most people is how we're going to navigate the COVID dynamic. And so I believe, hopefully I've covered most of that, but I will tell you, I'm really proud of our staff in the preparation right now that we're getting ready for the school year, both for COVID, but also for the work that we're doing to improve on teaching and learning and focusing on our students being the priority for us, both for their health, their social emotional well-being, and specifically their ability to learn and grow. So with that said, Steve,
Yeah,
if you
there's
go on, I think I'll pause right there and answer any questions that may
Yeah,
have been.
there's a couple questions. One is, have you made facility improvements at schools that help with the protection of students and your staff, physical improvement?
Yeah, and I'm gonna apologize because sometimes I forget the names of these different components, but all of our air systems have been improved, and they have I'm gonna forget that all of them had additional pieces added to them that basically, as the air is moving through it, it actually kills certain levels of virus that move through our air filters and our air systems. And we have air purifiers in every classroom and every office area that's been installed. All of our filters have been changed prior to the start of our enrichment jumpstart camps. And we change out all filters regularly. We put a lot of effort and energy and dollars into making sure that our heating and air conditioning systems are where they need to be and are cutting edge.
Good to know too. Do you have any information as you talk with your colleagues, superintendents and others within the educational system about when they think that vaccines might be available for children under 12?
I've heard lots of different things, and I don't necessarily have any better answer than Dr. Wonnacott on that. At one point, I had heard that we may see it as early as September, but we're coming on September and haven't heard anything more. So I think that's obviously been pushed out. You do mention something that's important in my mind. I know that parents have choices to decide if their children are going to get vaccinated or not. But the vaccination is available for the 12 and older, and I do believe we have a small, well, I don't know the exact percentage, but I think that 41% of what we're saying is the folks are vaccinated in our town is probably about the same for our 12 and older students, and want to encourage folks to consider that as we have it available. And then, of course, once it is for students younger than 12, I hope that folks would consider that. Understand it's parents' choice when they want to look at these, whether they want to do a vaccination. We had thought it may be set as a requirement like other vaccinations that happen in schools, and which may still occur once it's fully through approval. But again, that would just be us following whatever guidelines and directions and mandates are in place. So I'm sorry I don't have any more detailed answer on that, but I do know that we just want to have a safe, healthy environment. And if the vaccination is what can help us do that, we hope that folks are taking the time to get it. And obviously, it's been mandated for our staff.
Are there some innovations that have happened in how you teach and maybe some curriculum updates that maybe either have or have not anything to do with teaching in a COVID kind of situation? I know you are very proud about innovations and working with your team members on the latest teaching techniques and curriculum.
Steve, thanks for asking that question. Related to COVID, right? We had to make sure that we were prepared and ready to go to a virtual system, and in doing so, our teachers had to step into creative technological methods. And when doing that, it actually is effective and efficient when we even return to regular normal schooling with students in the classroom, as technology can help our students access information outside of the regular class day. The teachers can be providing information in different modalities, which helps and enhances the different types of learners that are in our classes. And so our Canvas platform is one of our learning systems that's really important. Just to talk about one that has actually been a little controversial, we utilize a system called MAP, Measurements of Academic Progress for our students. And it was in place prior to my arrival, yet we made a decision to truly implement it across our entire system. And one of the things about that is we felt as though with technology, this is a technological platform that we could assess our students even when they weren't in the school. But one thing I would also love to be able to share with folks is that how the assessment works is it really works to truly know what the students know and are able to do at their current level, but also what students may be struggling with and be able to target those needs. So if a student really is, and I make this kind of simple in reading, is able to read, but then has some comprehensive components that the assessment can actually drill down to what we need to specifically focus on and support that student. What's so important about that is oftentimes what you do when you have students that are struggling, you pull them out of class and you give them a blanket of intervention. Now we can sit there and look at what is it specifically that student needs, have them out of class as little as possible, provide them that kind of, in essence, booster of information and support in that area. Meanwhile, while they do not miss the current grade level curriculum that they need to be getting. So really important that we're working on that. And again, some folks were not very pleased with it at first because they realized that their students were getting answers wrong. And everybody's really ready to have, when we assess, we want students to get answers right. But the assessment's adaptive because it adapts to whether a student is answering questions right. Well, then it gets harder. And then if they start to miss them, it gets easier. And it gets really into what we call their zone of proximal development. And it really gives us a great deal of information to be able to support and provide that to them. I can keep going because there's some other stuff. Well, and stop me if there's a question that's popped up, but in our LCAP, our local control accountability plan, one of the things that we've been working on is how do we enhance the different experience of students that have unique interests, unique talents and skills. And we want to help them discover and foster those unique talents and skills. And so we've advanced, we added another music teacher this year to try to support the performing arts. We also added 4 positions that, at our high school, we have career tech education into 4 different pathways. And then we have hired what we call our CTE specialists that are going to design and implement curriculum for students K-8. And in the elementary level, start to discover what career options do they get excited about? Are they interested in? And as they move, then we like to say the word discover. And then as they move to middle school, they start to explore and look at what their aptitude alignment. So as they get to high school, they'll be ready to think, oh, this is the pathway I want to go into. So it's just another component that we're working on that I'm really excited about. Like I said, I could talk about this stuff forever because this is in essence my wheelhouse. COVID and medical. I've said this a lot. Over the last few years of being a superintendent, I learned a lot about facilities. I'm not a handy guy. Picking up a screwdriver kind of I stumble with, and then healthcare. There was a reason why I didn't become a medical doctor for sure, because blood is not my thing. But I've had to learn so much about it. But education is, and I'm so passionate about it. So I appreciate you letting me share a few things.
Absolutely, we appreciate the sharing. There are a couple of other questions about when the young folks are in school and it's time to go out in the playground, they need to keep their masks on.
Oh, yeah, something I didn't share, so I apologize about that. So the CDPH guidelines, California Department of Public Health guidelines, require and mandate masks inside. And they are not required or mandated while you're outside. And so we're going to encourage folks to wear them even while they're outside, but they're not required.
Okay.
So one of the things we're encouraging our teachers and staff, especially during our warmer months, is to get students outside as much as possible.
Okay. And then if a teacher doesn't happen to be vaccinated, will the teachers wear masks outside when the young folks are playing in the playground?
So again, vaccinated or unvaccinated outside, the masks are not required. Okay. In conversations with our employee groups, they are hopeful that we will be encouraging that. And actually the guidelines say it. We encourage to wear masks outside. So we will do so, but we won't necessarily require any and all folks, adults or students outside that have to wear the mask.
What are the guidelines with respect to sports, football, volleyball, the different sports during the school year?
Yeah, thank you. And I had a note here say something about it. So I appreciate that we're getting some of the things I missed in my start. So, two things. We have California Department of Public Health we have to follow, and then we compete in Nevada Interscholastic Athletic Association. We have to blend and follow both of those components. And so for the fall, most of our sports are outside, and so we don't have to wear masks outside, so we don't have to worry about that. With volleyball is the one concern. The NIA did follow through and say we do not have to wear masks while competing, and we're going to follow the NIA's guidelines on that. One thing I will say, and I just want to let folks know, if they're attending indoor sporting events or anything indoors, there is a requirement for spectators to wear masks at those events. And if folks aren't going to, of course, we're going to ask them to do so or leave. And if folks refuse, and I hope that this isn't the scenario, but we'll end up finishing the event without spectators, just because we want to make sure we do that. All of our athletes have to go through regular weekly testing, and same as the classroom is if they've had a close contact, vaccinated with no symptoms, they get to continue. If not vaccinated, they have to make sure they go through that 3 to 5 days and then get a test to be able to go back and compete. Which I'm hoping we can kind of take a really close look at this, because we need to keep students in school and we need to keep students participating in their sports. So that's to me just pressing.
So I think you touched on this a little bit, but somebody wanted to drill down a little bit deeper. So if a student tests positive, what protocols do you use at the district for contact tracing and notification of close contacts? How are those defined for the schools?
Yeah, and I got to tell you, I'm going to do my best to answer, but we have staff that are really the ones that are going to be working on this, our school nurses and some of our educational personnel. If we have a positive case, they will contact trace in regards to who was in proximity with a student inside a classroom, and that spacing distances of, and Dr. Wonnacott mentioned it, within 15 minutes, less than 6 feet, they will be considered close contact. And then we will go through that process of quarantining a classroom. A couple times last year, I think we made error in essence of not contacting the entire classroom, which we will do, and then that there was a contact, but that their student wasn't a close contact, so that they're aware of that. And we'd also let the school know that there was a classroom. We got to be careful in regards to whom and what and how in regards to HIPAA rules and regulations, but we will be communicating as effective and timely as we possibly can. Sometimes that's what happens is we're in the process of trying to determine who was a close contact or not, and so sometimes information gets out faster than we can finish what we're going through. So just ask folks to realize that we will be communicating.
Okay, and then on school buses, masks are mandatory, I would assume. Yeah,
the same practice, and again, I appreciate that. What we have had students do is as they get on the bus, they have a mask on, and we hand sanitize. And the mask is meant to stay on that entire time, and as they get off, they hand sanitize. And the same practice going in and out of classrooms as well.
Got it. Okay. Any other issues that you wanted to bring forward? Appreciate you answering the questions that we've received in the Q&A box. We have another couple of minutes with Dr. Cutler if you have a question you'd like to ask. But yeah, it's it is exciting to see the students get back in the classroom and interact with their teachers and be able to play sports and participate in the other extracurricular activities that are really a part of the educational process overall.
And Steve, I really appreciate that. And again, I just thank everybody for having patience with us having to work through and navigate all of these requirements. And again, that's the goal is to keep students in school. I would tell you, I hope CDPH doesn't change the guidelines at all from here, because if they were to go back to social distancing, excuse me, that may make a change in how we have to go about doing school. I do worry about, because the Delta variant has been so prevalent, and watching schools that have already opened throughout California and seeing all the quarantining, I worry about, as school arts district, our side with the resources we have is how many staff end up being quarantining, and do we have enough substitute teachers? And so all of those are stresses for me, just to let folks know that. And
yep.
and the worst case scenario would be that we would have to go virtual because of quarantining, not necessarily because of anything else. And I use that as a worst case scenario, because we're going to do anything and everything to keep our students in the schoolhouse, in their classroom, every day learning. But I throw that out as a possibility, just because it could happen. I'm on the flip side. I hope that, because as Dr. Wonnacott mentioned, it seems like we're plateauing on the Delta variants, and maybe, just maybe, we'll be on the downhill slide as we open school on August 30th, and we'll see this continue to be in a better place. And that's where I'd like to keep the thinking is we're going to have a good start, and we'll even get better from there.
Good. I know you have a robust communication system with parents of the students and family of the students that are in your school system. Is there any place that you have on the district's website where people can get information?
Yeah, you know what? And I wish I could pull it up right now, but all of that, everything that we send out to our families goes up on our website. And you know what? For everybody that's listening, because I've just been asking our team to improve the navigation of our website so that folks can find things. You should be able to get there and see. We recently sent out to all of our families and our staff all of these guidelines and exactly how we're going to process through that, and including how we're going to manage masks or not. If somebody doesn't come with a mask, all of that's on there, and you should be able to find it relatively easy on our website. And so, because I'm worried if I could pop up onto my website right now, I wouldn't be able to help. But please give me any feedback on that too, because we are trying to make it more accessible and not so difficult to manage through.
And the site is LTUSD.org.
LTUSD.org.
Right.
Yeah.
Well,
absolutely.
Dr. Todd Cutler, we want to thank you for being with us today. We know you have an important meeting coming up at the top of the hour here. So we want to make sure you get to that. But thank you so much for sharing and being with us. And I suspect we'll have you back as things proceed.
Steve, I appreciate you asking for me. And yes, whatever if I could help in any way or provide information, I want to be able to do that. So thank you. Have a wonderful day. Good weekend.
Okay. And thanks to all of you who were able to join us for the town hall today. We'll stay tuned. I know that other things are happening. There's a Region 5 forest closure in California that does affect the lands of the Lake Tahoe Basin. So all of the Forest Service properties around the Tahoe Basin, in addition to all the other national forests in California, are going to be closed, at least temporarily, starting at 11:59 this Sunday. So that's right before midnight this Sunday. And right now the closure is to go through 11:59 on Labor Day. So Monday we'll have to be alert to see if there's any further closures. But what we hear from the folks who are on the front lines of the fires, including, of course, the Caldor fire, which is the one nearest to us in Dorado County, is that the fuels are just really, really dry. So the winds make a difference. All of those things make a difference. But what we're experiencing now is extraordinarily dry fuels. It's part of the drought. It's part of just prolonged periods of without moisture, not having a particularly robust winter last year. So we'll continue to keep everybody posted through our channels at Tahoe Chamber. Want to thank our team and want to thank Emily for her service to the chamber. This is probably her last town hall with us, but she's staying in the community, going to work for the city, still be a big part of what we do here in the greater South Shore area. So stay safe, keep in mind the COVID, take all the necessary precautions, and we'll be back with you again soon. Take care.